Hey, sorry for the distraction of the bandage. Believe me, you don't want to see it until I heal. I got fascinated by the transformation of Finland from the lowest life expectancy of any country in Europe to sneaking up on some of the best. One of the key doctors behind that transformation is Pekka Puska, virtually unheard of in the US except among nutritional scientists where he's revered, but very well known in Europe.
It's good for me. So good morning or good evening for you.
Yeah, good evening for me. Good morning for you. Sorry about the distraction with the Band-Aid. I had a big ouchie on my nose, and it even included a skin graft for my ear. So my one of my granddaughters said, well, you can't just wear a normal Band-Aid. That would be too boring. You got to wear a...
Okay, good.
She had various different choices, and one of them was unicorns.
Okay. Yeah, I watched the video that you sent me. Very interesting.
Oh,
very
good. So how much of the stuff about you did I get wrong?
No, I think it's okay. Perfect.
Oh, good.
No problem.
I thought you might jolt a little bit when I put the photo of you getting your honorary doctorate from University of Lisbon, I think, where I said you were the chancellor of a university. But, you know, trying to explain all that, I just wanted to keep it moving. So you looked like you were dressed like a chancellor.
It was a nice ceremony in Lisbon. But even better ceremony was many years earlier when I got the honorary doctorate from St. Andrews University in Scotland.
Oh, you did?
That was quite a ceremony for 3 days.
Wow.
You know, St. Andrews is the third oldest university in Britain after Oxford and Cambridge.
Yeah, wow.
It's quite a ceremony.
My family is from Scotland. My name is Scottish McCaskill. And
okay, good.
So I've been over there a bunch of times and love it. Can you give just a 30-second thumbnail of what the North Karelia Project is? Just for listeners who are tuning in, I want them to get some sense of what's going to happen over the next however long we're on.
The North Karelia Project was started in 1972 in eastern province of North Karelia, Finland. And the background was that Finland had the highest coronary heart disease mortality in the world, particularly in eastern Finland. And there was a petition by local people, do something. And we, as a young research team, started to think what to do. And we realized that there is a pretty good evidence on a number of risk factors, particularly smoking, cholesterol, and blood pressure. And those factors were very common in the population. And we realized that we need prevention. We need to tackle these factors. We need to influence these lifestyles in the whole population. And after 25 years of intensive, comprehensive work, we could see extremely good results. All these risk factors had reduced, smoking had reduced, blood cholesterol levels had gone down. And the best thing was that the annual mortality of heart disease among working age population had reduced by more than 80%. So it was big success. I could never ever have believed in the beginning that we can receive such a huge success with chronic disease.
It's amazing. And you wrote this book, what, 20 years in, something like that?
Yeah, we wrote a number of, we did a number of reports, and that is the latest comprehensive report. Although just fairly recently, this journal Global Heart asked us to make a special issue. So this is the most latest report of the North Karelia Project and offspring studies.
Oh, wow. I'd love to get a copy of that. It's just the most amazing story, and nobody in the U.S. has ever heard of it. I hadn't heard of it until I was doing that episode on the 7-country study. And then I emailed Henry Blackburn and said, why hasn't anybody heard of this guy in this study? And he said, the knowing know about him.
Yeah, Henry Blackburn has been so much involved in the project from the very beginning, because after the petition from the local people in North Karelia, Finnish Heart Association convened an international expert group with WHO experts, and Henry Blackburn was among them. And that planning meeting really outlined the strategy that we then took on.
He's just such a wonderful guy. You know, I was emailing him 2 or 3 times a day to ask him questions, make sure I was fact-checked and everything for this last episode. And then one day he didn't respond quickly like he usually does. And I was wondering where he was. I was hoping nothing happened to him. He's 96. And at the end of the day, he sends me this wonderful photo of himself out on his ski boat with his daughter and great-grandson, just having a great time on a Minnesota lake. So
yeah, he's a great guy. We had so much contact with him during the years of the project, and he always really helped us.
Yeah, he's a true jewel of a guy. Tell us a little bit about your educational background. It looks like you have an MD and a PhD and a master's in political science.
Yeah, after my college in my hometown Vaasa, I went to University of Turku to study medicine because that was very popular at that time. I have always been also interested in kind of societal issues. So during my medical studies, I also signed in at the Department of Political Sciences. And then I made a master's degree in political sciences. And then later on, I graduated as a medical doctor. And with this background, being a medical doctor and also master in political sciences, it was pretty natural that I became affiliated with the Department of Public Health of the university. I must also say something that has influenced my career and also the people in the project team, that I was quite active in the student organization, which was pretty radical at that time. And I was then president of the student union of the university. And later on, in 1970, I was the president of Finnish National Student Union. That also took me to some of the planning activities of the government. And so when the old boys decided to ask me to be the director of this new project, I think it was this combination of being medical doctor, master of social sciences, and also having some planning experience.
You also, as part of your education, there was epidemiology in there too?
Yes. Not very much at that time, but there was some, yes.
Was epidemiology in the day, was it mainly for infectious diseases? Was it used much for this kind of lifestyle disease?
Yes, it was mainly infectious diseases, and actually the term epidemiology was not very much used. It was mainly a question of epidemics.
So that's how they chose you, and you were 27 years old when you started, right?
I think you have calculated that, yes.
Yeah, you were 27. And those photos, you looked very dashing with that full head of hair and everything.
Yeah, I was pretty young, and of course I collected my friends at the Turku University, and the whole team was very young, and we had a kind of radical optimism because during the student movement, which was very active, as you know, at that time also in Central Europe, we wanted to change the world, but with the North Karelia petition, we just wanted to change the public health.
Did you ever imagine it could turn into transforming the health of a nation? You know, I'm still gobsmacked by the story. But anyway, so you're 27, you get asked to do this thing. Can you explain why they chose a 27-year-old to do this?
For the planning meeting in Joensuu, the Department of Public Health of Turku University was invited with Professor Sievers. And as part of that team, they asked me to be the secretary of the planning meeting. So that made me more involved. I was still in the army then during my military service, but then the old boys convened, and then they decided to ask me to be the director of this new project. And I think the background was really that they thought that I have this kind of suitable background, but it was very risky because I was quite young. The whole team was very young. A few years before he died, Professor Martti Karvonen, much later on, he told me, jokingly, of course, a bit, that one of his best decisions was to invite me to be the director. Not because you were good, but because you were young. I saw that it has to be a long-term project for chronic disease control, and I think it was his wisdom. After they had appointed me, I went to his office at the institute in Helsinki, and I said, Martti, I don't know too much about heart disease. You must help me. And he said, Pekka, I've had my projects. This is your project. But of course, he helped us he helped us a lot. But I think it was really, I think what is important was that that we had a young team, radical team, that was not so much stuck with old ideas, but we really wanted to make a radical change. And so the two main innovations came from this thinking. And one was that for this kind of chronic disease like heart disease, the big potential is in prevention. Of course, we need hospitals to treat the patients. They may save lives. But to change public health in the population, you need prevention. And the second thing was that although at that time we knew much less about heart disease than we know now, there were already these pretty good results from Framingham 7-country study about the very likely causal risk factors. At that time, the 3 classical risk factors: serum cholesterol, blood pressure, and smoking. And we said, okay, there is solid information. Let's try to see how much it helps to try to reduce those risk factors, but in the population, not among patients. And the second big innovation was that we realized that they really relate to lifestyles. And lifestyles are features of community. So that led us to the first, which is called nowadays community-based program. Of course, because we were a very young team, scientifically not very experienced, so there was a lot of criticism. Old cardiologists asked, what the hell are you doing? What are you saying? Community-based prevention. We don't know how to prevent. And now you are speaking about community-based prevention. So it was pretty radical, but now it is common science.
And North Karelia, can you describe it? It's near the Russian border, or it's up?
Yeah, North Karelia is the easternmost province of Finland at the Russian border. At that time, there were about 180,000 inhabitants, fairly large area, semi-rural area, beautiful area, forests, hills, lakes. At that time, people were pretty much farmers, lumberjacks, of course, some services. Of course, the war had been very bad, Second World War for North Karelia, because there had been these huge battles for 5 years, but the economy had started to recover. At that time, when we started, the North Karelia was still fairly poor. The infectious diseases were bad before World War II, and even after World War II, there was still an epidemic of tuberculosis. But then gradually the income level started to increase, standard of living, and there was less infectious disease. But these new diseases, heart disease, stroke, cancer started to grow. Even in the 70s, when we started, North Karelia was still quite poor. Later on, when I have been speaking about the project all over the world, many people say that, yeah, it was so easy for you in Finland because Finland is so rich, you have Nokia and everything. And I told you, North Karelia was extremely poor. There were a lot of small villages without even electricity. So it was pretty poor area. To change the subject a little bit, at this kind of meetings, people also say, it is so easy to work in Finland because people are so nice. It was so easy. We have so many difficulties for prevention. And I told you that you should have seen, there were poor people, smoking were their only pleasure. They were producing the fat themselves, dairy fat, and we asked them not to use them. Clinicians were suspicious, what are you doing? So it wasn't easy. It isn't easy anywhere.
Graduating as a doctor, I would have thought your aspiration would be to work on patients, but you were mainly doing, it sounded like community organizing. You in another interview, you said it was boots deep in the mud, just on your community projects.
Yes, let me also say that at that time, at the same time, in Eastern Finland, a new medical school was established at the University of Kuopio. So when I got the task of being the director of the project, I moved the coordinating center to the University of Kuopio, close to North Karelia. And so that helped. I think I have always been interested in public health, and the project really was something that was very tempting to me. Of course, I could never ever believe that the future that will come. But I realized, and the team, we realized that we have really to move around with the people health, to move around the population. Nowadays, when I am at the meetings and deal with this kind of preventive project and preventive strategies around the world, I see very much good paperwork. There's mushrooming of all kind of evidence-based strategies and programs, very good ones. But where is the problem? It's the implementation gap. Implementation needs really hard work, and part of the success of North Karelia Project was that we really did a lot of work among the people, as you said, boots deep in the mud.
So can you describe some of the projects? How did you get, like, I think you mentioned in the book that most people in the day learned about nutrition from either the radio or the newspaper?
Yes, it is not easy to tell what we did, because we did so many things. Afterwards, when I've looked at some of the old papers, I realized, oh, we did that and that and that. Of course, we started with some information campaign, but that is only the beginning, leaflets, publications, and so on. And that is where many projects stop. They think that just giving information to people helps for change. We started then to work with the health centers, particularly with the public health nurses who work close with the people, but also with doctors, general practitioners. Then we started to work with non-governmental organizations, not just the health-related organizations, but like housewives organizations, labor organizations, farmers organizations. Gradually we started to make contact with business, local groceries, local food industry. We started to work with schools, with projects with young people, because also when pupils learned to drink skim milk at school, then they demanded the same skim milk at home. So that changed their parents also. And from the very beginning, we had very good contact with the media. The media was very interested. It was not so much giving health information, but reporting of all kinds of activities. And then gradually also about how the results start to be good, how people are changing. Later on, when we became more on national level, of course, the political contacts for national public health decisions became important. We contributed to the tobacco law in '76 and to a number of dietary policy changes.
Talk about your initiative with the housewives. I have this vision of Finnish men who love their cheese and butter. They're lumberjacks and farmers. They're macho men, right?
They were farmers, lumberjacks, hardworking people. And interesting for today's epidemiology is that they were not obese and they were physically active. And this is what Henry Blackburn wrote in the book, that it was amazing to see those obviously very fit people, but were the coronary arteries full of cholesterol and having the highest heart attack rates in the world. Actually, taking a side issue, that reminds me, during the years, particularly in the 70s and 80s, we had a number of famous US and British TV groups coming over. And I remember very vividly, I think it was ABC's, was it Peter Jenkins? He came over.
Peter Jennings.
Yeah, Jennings. We were standing in a beautiful place by a lake, and he said, "Here I am in North Karelia. This is like paradise. Russian border is over there. And you will think that everybody is happy and healthy here. But no, this is an area with highest heart disease mortality in the world." So it was a bit kind of surprise. But if you looked at the results of Framingham and 7 countries, it is really cholesterol, blood pressure, and smoking.
I was going to say, you had an opportunity to talk to Peter Jennings. He was a smoker. He died of lung cancer.
Yeah. Of course, obesity is bad, but that's not the only risk factor. Really, blood, lipids, cholesterol are very important. Sorry, I forgot your original question.
I was asking about Finnish housewives, the housewife organizations, and how they influence the men.
Yeah. We're very outcome oriented. We tried to think of everything that we could do. And the Finnish men, those men, they were nice people, hardworking, but they loved their smoking, they loved the fat, they hated vegetables. And so we were thinking, how can we change the diet? And we realized that in that culture, and pretty much still, these housewives are quite important. And in that culture, and still in Finland, there's a very strong housewives organization called Marta organization that had a club, but nearly in every village. And we contacted the Marta organization that couldn't we collaborate. And it was really the housewife they were very worried about. They saw that the young husbands around them died of heart attack. So they were very worried, and they were very much interested in working with us, helping to prevent heart attack from their husbands. And so we had all kinds of parties. We changed the traditional dietary recipes to more heart healthy recipes. We had all kinds of evenings for long life with them, and they did a great job. And even in spite of the resistance of the husbands, I hear a lot of stories when the husbands say, I want to have the red, full, fatty milk. But the housewife gradually put in the can milk, which had less and less fat. And so the husband didn't even know. Or then they made all kinds of tricks, the housewives, to get the men to eat healthier. That was extremely important.
So, and you worked, somehow you worked with the dairy industry. There was a Finnish guy in our comments section who said you were treated pretty roughly by the dairy industry, but you had this initiative of dairies to berries.
Yes, of course the farmers were very suspicious, because you must realize that butter was and still is very deep in the culture. And during the World War, bad war years, people were suffering, there was no butter. And so the farmers, and it was their livelihood, they were very suspicious. And of course the local big dairy was very suspicious. But I think in that area we could pretty well deal with them, because the people also saw that it is question of extremely bad problem of heart disease, and probably there's something true in what the scientists say. But when the butter consumption even nationally started to decline, then the big national dairy industry became involved, and there was a big war against us in the late 80s. But at that time, the medical community had already bought our message, and that really was detrimental to the dairy industry, and butter consumption even went more down. And gradually, we have had, even with the dairy industry, more and more collaboration. They've changed they started to do more work for low-fat products, working with products with vegetable oil and so on. So there's been contact with them. But I must say that other part of Finnish food industry have been much more responsive when they've seen how people are following our messages. So some big food industry companies have considerably reduced saturated fat, reduced salt, and also new product with more fiber.
And you said that in the late 70s, some restaurants started introducing salads, and that was revolutionary?
Oh, yes. At that time, really, salad and vegetable consumption was pretty low. The housewives in North Karelia started to serve to their husband much more, because they could grow in their garden. But in the restaurants, only later on, and I think something that was very important, this was a national thing, that as part of the labor agreement, work site lunch programs came in, And in Finland, for a long time, the worksite canteens, they have a salad bar. And the salad includes in the lunch, you don't have to pay separately. And that has been extremely important. Speaking of old times, I don't know whether you want to ask, but from the housewives' work, I would also like to mention another practical work that became very important. That was the lay leader program. During my sabbatical at Stanford, I had good contact with the Stanford leaders, including Professor Ev Rogers, who is the father of the innovation diffusion theory. And the theory says that in the population, there are some people that are much more influential than the other. They are opinion leaders at work site or whatever, not formal opinion leaders. And we realized that, okay, we could use the theory. So from village to village, we picked up 2, 3, 4 opinion leaders in that village. We invited them to a seminar, gave them nice food, and told them about the project. And we asked them, please, in your normal work, not any special, in the normal work, you should pay attention to these risk factors, these risk-related behaviors, and try to influence your surrounding, your neighbors, and also your local grocery, and so on. And so we had up to 1,000 lay leaders all over North Karelia for a number of years, and we of course provided the material, and we have also published the evaluation together with Ev Rogers. He has been contributing, and it shows that this was a very important part of our success.
So you were a visiting scholar at Stanford in 1983, and did I read that you were involved in some projects like North Karelia, but in California for prevention?
Yes, a little after we started in Stanford, Professor Jack Farquhar started the work there, a smaller project, but then partly associated with the information from North Karelia. 3 US big projects, community-based prevention projects, were started with NIH money. And that was the Stanford 5-city project by Jack Farquhar, and then the Minnesota Heart Health Program, where Henry Blackburn was the leader, and then Pawtucket Program in Rhode Island, where Dick Carlton was the leader. So there were the 4 big community projects. You'll probably have a picture of the meeting of the 4 leaders.
And what was the success like? Was it harder or easier than in Finland?
My standard answer all over the world is that prevention is difficult. Every community, every population, there are advantages and disadvantages. We had a lot of disadvantages, but we had also advantages. And the same concerns US. The American project, they had much more money than we had. They produced much more eloquent health education programs, TV programs, and so on. But I think what their problem was, there was much less community organization, much less work in the community year after year, hard work that I explained. And that is why I think that the results of the American projects were more meager.
So you've served in the Finnish Parliament. In fact, you've had all kinds of positions. You were the Director General of whatever Finland's equivalent of the National Institute of Health is, were you not?
Yes. After University of Kuopio, the 5 original years, the government decided to transform the Finnish National Public Health Laboratory to a more comprehensive public health institute like CDC, and to be much more active in chronic diseases. The new department was established, and I was asked to be the director. So from that on, the coordinating center and the national center for the North Karelia Project was at the National Public Health Institute, where I served originally as a director department. And much later, I became the Director General of the whole institute. And about 10 years ago, another institute was merged, and now it's the Finnish Institute for Health and Welfare, where I served as first Director General. I became member of Finnish Parliament representing North Karelia in '87 when I thought that the project was already had been doing much work and I could do this. But at the same time, I think it was the governor, the strong governor who originally was very instrumental in starting the project. He was a very strong political leader, a friend of President Kekkonen. And he always told me, Pekka, these are political decisions for prevention and you should be involved with politics. So I became a member of parliament representing North Karelia for a period of time. But then I came back to the institute and I was then invited to Geneva to work as a director for chronic disease prevention at WHO headquarters in Geneva. And then after that, the government asked me to come back to the institute to become director general, which I did. And when I retired, then I served also once more in the national parliament, but then representing Helsinki. And I've always thought that my career is not a political career, but it is something that is really between hard science and then using the scientific evidence for public good.
And were you also president of the World Heart Federation, or what is that called?
I've been involved in so many international things. I was a president of World Heart Federation, very important organization. And then my good friend Jeff Copeland, who was at that time director of CDC, and myself, we were discussing why is there so little contact between national public health institutes. And we established an international association of national public health institutes. Jeff was the first president and I was the second president. And now there are about more than 100 national public health institutes in that organization, very influential. Speaking of chronic diseases, I could also add that I was for a number of years chair of the governing council of the WHO Cancer Research Institute in Lyon. So I've been involved in many international things, and that has always been of interest to me. Because, let me say, my career has really been first North Karelia, and then expanding to national level, and then later on with WHO and all these international activities. It's been extremely interesting to be involved in this global public health work where this control of this epidemic of chronic diseases is the second public health revolution. The first was control of infectious diseases. Now it's question of control of chronic diseases. This time it's not the bacteria or viruses, although we have this, of course, this COVID problem, and there will be infectious problems also in the future. But most people in the world are dying of chronic diseases. More than 70% of deaths in the world are due to chronic diseases. Every third death in the world is cardiovascular. So contemporary public health is so much depending on how well we can prevent and control these chronic diseases. And that means application of the solid science.
So the solid science raises a question. You started based on the results of the 7-country study, Ancel Keys, the Mediterranean diet. And yes. Did you ever waver? Because there's been this wave after wave after wave of popular low-carb diets. Back in your day, there would have been Atkins, and now there's paleo and keto and carnivore and primal and everything else. But did you stay the course with the Mediterranean diet?
Yes, over the years, year after year, there's been all kind of discussions, all kind of criticism to this kind of principles, theories of Ancel Keys, and this whole fat, cholesterol, heart disease hypothesis. But I have felt that the scientific community, I think, has been always solid that this information stays. Of course, we learn more and more about the etiology of heart disease, but I think there's no doubt that this is a very solid information. And I must go back and repeat that when we started the North Karelia Project, we did never say that this is the only answer, but we said that this is a huge problem. There is very solid information that cholesterol, diet, blood pressure, salt, and smoking are very influential causal factors. Let's reduce these factors and see how much it helps. And that's what we've done, and it's helped enormously.
It's been a revolution. It's been amazing. Ancel Keys in the day was a household name in America. And it was in a day when scientists were highly respected. These were Time Men of the Year, the same year that Ancel was on the cover of Time. Yeah. And now he's vilified on the internet. How is he thought of in Europe? Is he remembered, or is he a hero or a villain?
I think in the scientific circles, he is very respected. But of course, in the internet, there's the same kind of critics are around, even in Finland. But I think the mainline thinking among the scientific community is very, very positive. Because there's enormous amount of evidence from different kind of stories showing always the same thing, diet, cholesterol, heart disease. Of course, there are many other factors influencing. Speaking of Ancel Keys, we must remember that during the time when Ancel Keys and Martti Karvonen started the work in Eastern Finland, Martti Karvonen also directed a study that received a lot of criticism, but which was influential even for our project. That was the mental hospital study. They started in 1960 in 2 mental hospitals in Finland where the patients stay for years. They simply changed milk from fatty milk to skim milk with soybean oil, and then they changed the butter to vegetable oil fat spread. And after in one hospital, and in that hospital compared with the comparison hospital, cholesterol levels went down and heart attacks went down. And after 6 years, they switched over the hospitals. And in the new hospital, in the other hospital that now had the experimental diet, cholesterol levels went down and heart disease went down. And that was a striking demonstration, although, of course, there are a lot of scientific flaws you can criticize, and there had been a lot of criticism to that study. But I think it was a powerful demonstration.
Yeah, so Ancel Keys has the reputation of starting the low-fat craze in America, which doesn't check out. But even the Keys equations, which I think he created way back in 1965, he showed that saturated fat raised cholesterol about twice as much as liquid vegetable oils reduced it. But he did say that vegetable oils reduced it. Now in America, there's this, concern about seed oils. Where do you stand on that?
Well, when we speak of fat, of course, it is not a question of fat as a whole. It's a question of what kind of fat are we talking about. There is saturated fat, there is unsaturated, polyunsaturated fat. And the problem, of course, in Finland was that there was enormous amount of fat, and that was nearly completely saturated fat. So we started with the message, reduce the fat, because that meant reducing saturated fat. Of course, over the years, we have paid much more attention to the unsaturated, so much more to the quality of fat, so that it's no more in Finland a question of total amount of fat. It is very much about the quality of fat. Of course, there is a more scientific discussion, what kind of unsaturated fat, what kind of vegetable oil. It is quite clear that there are differences between different kind of vegetable oils. But I think that is still a minor thing compared with the original idea. I think PS ratio is still very important. Concerning vegetable oils, one thing which was very helpful to us in North Karelia was that originally when we said to people that you should switch to using vegetable oil, that was imported, sunflower oil, soybean oil. But then the Finnish scientists were able to develop a rape plant that grew well in the north. And since that we've had a lot of rapeseed oil, or the canola oil as you call it, and that had become extremely important. And I think also that the composition of canola oil is extremely good. But still the big thing for me is reducing saturated fat and moderate increase in or let's say moderate increase in polyunsaturated, and that is changing the pH ratio. And that is what has happened here.
And do you have an opinion on coconut and palm oil?
Oh, yes. I think palm oil and coconut oil are not as good. When I was director of the chronic disease prevention in Geneva, we published a pretty famous report on diet and prevention of chronic diseases, by the way, which recommended reducing sugar to below 10%, which created a lot of opposition from the sugar industry. But also as part of that, we said that particularly palm oil is not a very good oil. And I had a number of ambassadors from those countries opposing that. But I still think that they are not particularly good oils.
Do you think politics in Finland is a little less vicious than in the US? Because we have these big food conglomerates in the US, we have a bigger population, so it's a bigger market. We have less regulation, so lobbyists go nuts. Or is that just my imagination and I don't know enough about Finland?
Well, in every democracy, these kind of things are complicated. Finland is a Western economy, so we have pretty much the same kind of things. We have waves from international big industry. Years back, we had a tobacco industry here. Now it's more or less gone. Still, we have the same kind of waves. But on the other hand, I think to a certain extent, perhaps in the Finnish culture, it is a little bit easier to get things through. Finns are rather straightforward people, and this is a smaller nation. We know each other much better. When I was a student leader, my fellow student leaders, they are now important decision makers in Finland. And so it is easy to make this kind of contacts. And I think probably it's a bit easier to get these kind of things through. Like in the tobacco legislation, we have very strict tobacco legislation ever since the late 1970s.
Do you think you have as big a problem with misinformation about diet as we do in the United States?
Well, we have the same kind of problems, of course, with internet. All kind of groups, information is more fragmented. But I've always been optimistic, and I think the mainstream thinking is still pretty strong. We have medical community, we have the nurses, we have the scientists. Basically, people still in Finland, there is trust, very strong trust to scientists, even greater trust to politicians than in US, according to studies. But of course, the normal thing is that people say, we believe in what you are saying, but it's not always so easy to behave like that. It's not so easy to follow the advice.
Speaking of trust in scientists, my impression is, I don't have numbers, but my impression is it's fallen off quite a bit in the United States now over the years. And I was talking to Marion Nessel the other day, and she said she didn't know why Ancel Keys' last days, he didn't get all these awards. He didn't get a Nobel Prize. He didn't get lavished with all these awards. And you are getting lavished with quite a few. You're getting honorary doctorates from prestigious universities, all these high-level positions, and so on. Why do you think Ancel was treated like he was at the end of his career?
I don't know. I think he deserves all glory. But it is probably because public health is not so, so sexy as working with genes or molecular biology.
And you make enemies in public health too with the food companies,
right?
Oh,
yes. We can make strong enemies, but it's also rewarding, I think. I have received all this kind of criticism that you mentioned in the internet and in the minority scientific circles, but I think it is very rewarding, not only in Finland, where I still meet a lot of people in the street whom I don't know, who come and say thank you for what you've done. Without you, I wouldn't be alive. So it's very rewarding. And also the international work. We've been doing also a lot of work in Russia, where the problems have been very big. And it's been also very rewarding. You didn't mention that I'm also an academician of Russian Academy of Natural Sciences. And we've been working particularly behind the border in the Russian Karelia, where And also in Russia now, we start to see that the heart disease mortality has been reducing for the last 10 years.
No, I didn't know about you being an academic working in Russia. But I'm surprised that Russia didn't have poorer health than you. We just hear all these rumors about vodka and cigarettes and stress.
When North Karelia Project was started, Russia had better heart disease situation than we had. We had the highest mortality in the world. But gradually our mortality, heart disease, cardiovascular mortality started to go down. And in Russia and in Soviet Union, it started to go up. So that about 10, 20 years ago, there was enormous gap. Actually, we started the work in Russian Karelia because, in my understanding, the health divide between Finnish Karelia and Russian Karelia was the greatest in the world. I think in the life expectancy of men, it was something like 15 years. And it was pretty much the same thing that has happened in so many countries, that when the standard of living a bit starts to increase, they had more financial resources for butter, they had more money for tobacco and cars and so on. And of course in Russia it's also alcohol mortality. So the situation was very bad in the 90s. But gradually the diffusion of this new health information is spreading, and during the last 10 years lifestyles, I think particularly among the upper socioeconomic classes, have started to change. Health is becoming more popular and mortality is going down, but there's still a big difference between Russia and Finland.
What's the Nordic diet?
Well, the Nordic diet is just a variation of what we know. I mean, we've had different kind of names for the recommendations, and I think Nordic diet is a very, very fancy name of the diet that we have been recommending for years. Of course, they're always small. We refine the message a bit, not so much because science is changing, but because environment and diet environment is changing. So you need to change the emphasis. I think the basic scientific basis for our recommendation haven't really changed. I think it is surprising and very rewarding to people when people say that your recommendation change all the time. No, the scientific base has been surprisingly same for half a century.
Yeah, that's the amazing thing. Is it seemed to me that what came out of the 7-country study, even after 10 years, was pretty clear. I think you've said that. And then it just kept staying the same. The study's gone on 50 years. And the conclusion at the end is keep your cholesterol down, keep your blood pressure down, don't smoke, and move.
Yeah, we know very much about details, but the basis is just the same. I think one of the problem is that in the public discussion, you always need something new. And somebody coming criticizing this or developing some magic cure is tempting for the media. But I'm optimistic that in the long run, it's the hard science. And I've seen that, after some years, then again, come new young journalists who have invented, hey, it's cholesterol. Tell me about cholesterol or about smoking, how dangerous smoking is. There come new generations, and in the long run, it is the solid science that is important, although development goes in curves.
That's funny.
But having said that, one of our important strategy has been this monitoring of risk factors in the population, because when things go well, like it started to go well in North Karelia, we could give feedback that things are going well. People are changing, and I think in USA you call this bandwagon principle, that people start to change. But then at certain periods, we've seen also leveling off. And then we come to the media with very warning message. The good development has stopped, and that promotes new progress.
Interesting. You've been very gracious. We've gone on for almost an hour. I'm just looking at my phone to make sure I didn't forget anything. I wanted to end on two more questions. One is, are you taking into account environmental concerns now for the food plate, food recommendations?
Of course, yeah, of course. And in my talk during the last few years, I pay a lot of attention to the question of sustainable development, because the principles for sustainable development and principles for public health, chronic prevention, they go hand in hand. And think of all kind of problems that tobacco growing in Africa, for instance, concerns, or tobacco in the Western countries. Think of all these cigarette butts, of the environmental problems that cigarette butts cause. And even more concerning diet. I mean, the more we have vegetable-based diet, the better it is for sustainable development. So this has been something new to our message, not changing the message, but supporting the basic message.
It seems like it's a good thing that the basic message of what's good for you is also good for the environment. Fewer cows, for example.
Yeah, it is a message for sustainable development and good public health really go very much in hand. Of course, there are all kind of or smaller details that we have to consider, but the big thing is there.
So my last question, what does Pekka eat?
Like we discussed, my wife serves pretty healthy meal. I'm not I don't eat any extremes. Like I remember I met Nathan Pritikin. He was very extreme eating, and he was pretty yellow himself because of the carrots that he was eating all the time. But no, we eat a lot of vegetables. We eat a lot of berries, Finnish berries, because that is something that we develop. We cannot grow very much fruit here, but we have these fantastic berries. So we eat a lot of berries. We eat a lot of fish as well. And I more or less follow the North Karelia Project advice.
Well, thank you so much. You're one of my heroes. I'm so glad that you're getting some recognition and you get to be in these influential positions. It's just such a pleasure to meet you. I think, I searched the internet for interviews with you and I could only find one of any length or any depth.
Yeah, I've been looking for the old TV spots from the late 70s and early 80s with the ABC and CBS and BBC and Al Jazeera. At that time, we didn't get any copies, so I have not been able to have available. It would be nice to see them.
I wonder if I could find those. I'm glad you mentioned that. I wonder if I could find those through a stock agency. Sometimes you can find those old programs. I'd love to include it in this one because I just feel like you're... Yeah, I'll look for them. I did search for clips and I found quite a few of them. Pekka's been in the media a lot, but they're owned by Getty Images. And I don't mind paying the $800 per clip to include in this episode. I don't make any money off this channel anyway, but I couldn't stand the 1-year licensing term. That was a deal killer. Anyway, this one from a British television station showed the school lunch program, which was fascinating. Kids are eating lentils and whole grain bread and fruit right in their own classroom and learning to love that stuff.
Crisp bread and low-fat spread. It's all eaten at their desks, the teacher re-educating their palates, removing high-fat food from the equation.
Because I just feel like you're very underreported. This whole, it's just such an amazing turnaround. As you saw from my previous video, when I turned on the BBC the first time I ever came to London in 1980, they were talking about Finnish health. They were talking about European health in general, but they were saying that Finnish men used to have the lowest life expectancy of all European men, and by 1980 you had already overtaken the Scots, and you were creeping up on some of the others. So, pretty good.
Yeah, well, I feel that at least in the international public health community and chronic disease epidemiology and prevention community, our work is well known. So, but I've enjoyed this discussion. It was a great discussion.
Yeah, I've thoroughly enjoyed it too.
Enjoyed this discussion.
I've enjoyed it too. It's been a great honor for me, and I come from earth science, And so I have this perspective of we've got to stop clearing land, and we can't be eating the animals like even the fish. You probably get better fish, but we've burned so much coal. There's so much methyl mercury in the water now that the fish are getting contaminated and the oceans are getting depleted and so on. And I thought Ancel Keys was very smart when he said that the Asian diets are just as healthy as the Mediterranean diets, if not even a little more. But the sensibility of Americans, they would adapt. He was wise enough to see that they would adapt to a Mediterranean diet and lifestyle more than they could an Asian one. And I feel the same way. I like that the world, there's a higher percentage of vegans. The more vegans, the better, I think. And but if people just followed your diet and what you've promoted in Finland, it would revolutionize the world.
Yeah, you mentioned China. I've been doing a lot of work in China, even very recently with the Chinese Ministry of Health and the China CDC. And I always say that you can have a very healthy diet based on different cultural patterns, as long as you follow the principles that Ancel Keys developed.
They had a professor who died not too long ago at 110. He worked till he was 110, Zheng Ji. He went by two names in China. He was American educated, got his PhD over here in the 30s, and then moved to China and was their most popular professor and very famous for living and working for so long. And he wrote some books, and they were all in Chinese. You can buy them on Amazon. So I bought one and had it translated and read it. And he said, you know what? The diet I recommend is 10% protein, 20% fat from unsaturated sources, and 70% whole plant foods. And we in China put vegetables at the center of every meal. You Americans put meat at the center of every meal. We put vegetables at the center of every meal. And, I mean, it's hard to beat that. It's just, the sensibility of Americans probably leans towards Mediterranean more, but they're very similar.
Yeah, they have the same problem, particularly in the big cities, that people are changing their diet more to Western diet. There's a lot of smoking, and in the big cities also the air pollution is bad, so they have more and more chronic diseases, and that's why they're being very active. I was chairing actually a task group of the Chinese authorities for prevention of chronic disease, because they see that this is their big problem. But there's a lot of good research there as well.
Yeah, I know. Okay. All right. Thank you so much. Have a great rest of the day in beautiful Finland.
Okay, and have a good night there.
Thank you. Thanks for watching. I hope you'll like and subscribe so we can get more guests like Dr. Puska. One of my heroes is David Attenborough, and I dream of having him on the channel. Also leave comments. I read them all and answer a lot of them, and some of them have asked me to do specific episodes, and I did.